Thank you for joining us again today for our Healthy Perspectives. Today we have with us Dr. Dwayne Thwaites speaking on the subject of men's health. As we recognize, men's health is something in many lines, not just here in Antigua and Barbuda, that is overlooked. Our desire is to encourage you, not just the men, but wives, mothers, sisters, to encourage your men to continue their health checks. So, turning our attention to Dr. Thwaites today, we ask you that question, Dr. Thwaites. Why do you see men's health as a problem here within the Caribbean?
Absolutely. I think that one of the things I must say, being raised up in the Caribbean in its entirety, been around for a while.
You're still a young man.
Yeah, well, I look young because I follow the rules of men's health.
Okay, there you go.
But I think that the Caribbean men on a whole, for some reason, don't really take very good care of themselves. I think that sometimes we think that because of where we are and because of all the beautiful weather and everything, that we think that we will just enjoy this and enjoy it to the fullest without having a problem anytime in our future, and then we live and then we just die. I don't know if this is something that is just instilled into the Caribbean man, but we all raised up in that way. We go out, we enjoy ourselves, and we don't really take care of what we have. And I think that that for some reason it's a big major issue in the Caribbean. A lot of the men in Antigua, not only the men, but they go out, they party, they drink, and then they go to work, and they really don't take care of the vessel that allows them to do that. And then that's why I'm very appreciative of the fact that the AUA has decided that they want to do a program about men's health in the Caribbean itself. I think that over the last 7 years, being working with the men in Antigua, we have started a trend. And I think that now that you are doing more of a comprehensive evaluation for men, that things are really picking up. Information is getting out, and I think that we can handle and take on that persona to help these men in Antigua and help them get a brisk of what healthcare is about and how they can best take care of themselves.
So we talk about, and we hear the issues of hypertension, diabetes, and so forth. And I think across the spectrum, both male and female recognize the issues or the damage, if you would, that having these diseases can cause. But specific to a man, what does having hypertension and or diabetes do to me as a man? How does it affect me?
I mean, again, and it affects you in multiple ways. I mean, we could go on forever and tell you some of the problems that we have in trying to help people control their blood pressure and what it does. Again, you could talk more of the general stuff. Your pressure is too high. If your pressure is high, those little blood vessels that you have can't contain the pressure that high for so long. It's like plumbing. If the pressure in the tube is too high for too long, one, it damages the tube. Two, once the tube breaks, then it affects you. You get strokes, you get heart problems. The other thing is the other organs are damaged. I mean, high pressure beating up on the liver can cause cirrhosis, can cause thickening of the blood vessels, decreased blood supply to the liver. You can talk about kidney disease. We see Kimler-Steele-Wilson is one of the diseases of the kidney because the pressure is so high, it causes scarring in the tissue. Again, for the local layman, you got to understand it's like water going through a tube. And if the water pressure is too high, it damages the tube itself, and then it can damage the tissue surrounding. So we see damage to the kidney itself. So high blood pressure can damage the kidneys. And then high blood pressure, if it's there and it's too high, can damage your vasculature, the blood supply to the legs and all of these things. So you have a slew of damages that can be done if the pressure is just too high. It will damage the tubes, and if it damages the tubes, it will damage other organs. That's high blood pressure. Diabetes causes so many different things that can occur. Your whole immune system changes with diabetes. Your eyes get damaged because you drop some cotton spots in the back. You get retinal problems. Again, your nerves. The high sugar in the nerves deposits sorbitals into the nerve, and that in itself will cause you to have decreased sensation, the pinprick. Once you have decreased sensations in your legs and you can't feel, you put your foot in hot water, you won't even know it's hot. And this is where you have the cascade of different things happening. You get damage, you don't know you're damaged. You get an infection, you don't know you have an infection because your immune system goes. So we could talk about myriads of things that diabetes can do. Cholesterol clogs up the blood vessels. Cholesterol with high blood pressure is even more dangerous. You can form clots inside because you have the cholesterol plaques, they damage the vessels. It will chip off, it can damage your eyes, you can get blind. It can damage your heart attacks, and then your brain. Serious cerebral vascular accidents can occur. You get strokes, you get all these kind of things. And so when you're looking at all these entities, the most important thing, which is what the Men's Health is talking about and is stressing, is preventative medicine. Exactly. We know that these things can damage you and can hurt you. And so what you want to do is prepare yourself. This is like what we've been doing all along with screening, doing prostate cancer screening, because we want to practice preventative medicine, and that's what you're doing. Why doing something which takes care of the whole person on a whole? You are preventing them from having problems. So again, for me, I have friends here on the island, friends and family, and it's difficult for me to see a young guy come in and has a stroke because he didn't take his high blood pressure medication, he didn't take care of his diabetes. One of the things that we see a lot of, which I think you guys are going to stress and should stress at the Men's Health Day, is when you take a blood pressure medicine and your blood pressure comes down, it doesn't mean you're cured. Exactly. And a lot of people think so. The problem is, and they take it, it comes down, they stop, and then when it goes back up, they take it. Now that's wear and tear. That's like having a wire and just keep going back and forth. And that causes severe damages to the blood vessels. So, the medicine is to bring down the blood pressure and keep it down. If you stop taking, not because it's down means it's down. Right. Yes, you have to continue to take your medicine, keep it at that level so it doesn't damage the blood vessels and causes the things that we're talking about. So yes.
But I hear youth or young people speaking in my head as you're speaking to say, you know what, this is what happens to the older population. These aren't things that are happening to me, the 20 or 30-year-old. Would you agree or disagree with that?
Absolutely disagree. When we see it all the time, we see young people coming in with complications from high blood pressure, from diabetes. It occurs across the board. Now, when you get older, yes, some of the blood vessels do changes, but again, if you start at a younger age, you won't have to worry about it when you get older. So that's one way of looking at it. But yes, it does affect young people. We have young people out there with lots of complications from high blood pressure and different medication. One of the problems that we have when you're very youthful, you don't want to take medication and you don't want to do this. But if you are smart enough and know that being youthful, that you want to live for a longer period of time, you have to start off by taking care of yourself. Again, we come right back around to your program, Men's Health. This is why you want programs like this. This is why you want to keep moving on, because we can help you live a longer, better life. You don't want to live to 80 but in a hospital stroked out. Exactly. You want to be enjoying. You want to go hang out. You want to enjoy the 365 beaches that the island have. You want to go carnival and jump up and all kind of thing. You know what I mean? And you want to do this in good health, and you want to feel good doing this, and that's important. Again, preventative medicine, health screening, programs that are out there, education, all of these things help you prepare for the future.
As we talk about the other diseases, those chronic non-communicable diseases, hypertension, diabetes, and such, there's still that component of lifestyle. And these are many times defined as lifestyle diseases. As men, what are some of the lifestyle issues that you think we need to address? You spoke about the drinking and the so forth previously. What are some of the other things that you think men need to adjust? What do we need to adjust in our lifestyles to be on a better track of longevity and good health?
Most importantly is the way how we eat. a diet. I mean, trying to figure out what your body needs and how you should approach eating it. Not eating too much, but eating appropriately. Looking at what you eat is one of the basic things that we have to start off with. If you don't exercise, it's a major problem. If you don't exercise, you have a problem. You need to be doing something because, look, let me tell you something, man. When you hear you do a good exercise and a good workup and your lung capacity is great, and any stressful event happens where you have to move quickly, you can do that without a problem. You need to be prepared. Again, preventative, you need to be prepared. It keeps the heart going, it keeps the blood vessel to the legs, it gives you that muscular tone that you need. It helps you lose weight. Some of these things are so good. If your diabetes affects, obese persons are just naturally become diabetics because they develop insulin resistance because of the obesity. You know, if you let them exercise and drop off a few pounds, that thing goes away. Same thing with hypertension. If you're obese, you will have high blood pressure. If you drop that off, it just disappears. So those are a couple of other things. Again, I mean, look, you need rest. You need to be prepared for your daily activities. These are things that you need to adjust to. You know you got to get in at a certain time. You need a complement of good 8 hours rest. You need proper sleep. You need some of these. And then if we're going to talk about communicable disease, again, protection. If you're going to have sex and if you know you're out there and having to go with many different women, I mean, at least use the condom. And one of the things I always tell them, the condom is about 95% safe. There's a few ones where if it bursts or if it's a bigger, and not only does it protects you from having kids, but it protects you from disease entities, and those things are important. So these are some of the lifestyle adjustments that needs to be done, and it needs to be pushed out there. Again, programs. People would listen to, have them talk about these things, and that's going to be so important.
And I'm glad you went in that direction, because when we speak about men's health, we find that many persons tend to think that we're only referring to a man in his prostate or a man in his sexuality. Dispel that myth for me, if you would.
Again, it's called comprehensive care. And it's, even though you say men's health, again, a lot, as I said, it triggers everybody. The big thing, and we know, one of the biggest killer of men is really prostate cancer. And so a lot of people think that when you say men's health, that's what you got to, and so they focus on that. But when you look at things like diabetes, they kill more men. Let me rephrase that statement. In terms of malignancies, that's with the prostate cancer. But there are other diseases out there, and what we don't see and they don't talk about much is because everybody sees diabetes as diabetes, but when you have a heart attack or you have something, they don't associate it with the diabetes causing that problem. So if we get more education together, and if we get the word out that we are looking not just that prostate cancer is important, men have breast cancer, men have different diseases that are out there, the diabetes, the hypertension, and all of these things. So we're not just focusing on one entity, the prostate cancer, because everybody's like, oh my gosh, that's cancer, I'm scared, and that's what men are. They have to now start looking at other things, other diseases that can take care. I can take care of much prostate as I want. I need to have somebody around to take, even though I'm taking them, to take care of. So therefore, if we channel our other resources into keeping men healthy and not worry too much about the prostate, but on the other issues, yes, we can definitely achieve. So they need to understand this. Word needs to get out. Men's health don't mean just prostate.
And I'm glad you touched on cardiovascular disease. In the last bit of research that we've done, finding out about heart disease and its prevalence here in Antigua and Barbuda, it's still the #1 killer amongst both men and women. And again, how much awareness are we as men putting on taking care of our hearts, and the fact that these other diseases contribute to it just as well.
yes, heart attack occurs, and the heart is a very important organ, but what leads to these things, and this is the basic building block and the basic things that we are trying to conquer now, the diabetes, the high blood pressure, the high cholesterol. That's what leads to the heart attack. So everybody looks more at, boy, she dead from a heart attack, you know what I mean?
Exactly.
And yeah, but why, you know? Or, boy, she had a pulmonary embolus. But why did they get to that stage? And you have to look at the whole sequela of things that lead to that. Bad diet, don't exercise, drink rum all weekend, have high blood pressure, have diabetes, take medication only from Monday, and take medication from the weekend because weekend he out to play domino, or, you know what I mean? Or he done a peppers and lime somewhere. I get a, you know what I mean, a groove, you know what I mean? But I must say, dancing give you some good exercise. So if they dance all night at peppers and lime, they've got some little exercise.
Get some good exercise. And here's one thing that I find we don't touch much on, and that's sleep. Because after you've exercised, you should be getting a better quality of sleep. How do you find in your practice, or do you find that sleep, the lack thereof, or poor sleep habits, poor sleep hygiene, how it affects us as men as well?
Actually, absolutely makes you miserable. Absolutely, you have no relaxation time, because nighttime you should be sleeping and getting some relaxation. What happens when you don't have proper relaxation time? Your blood pressure goes sky high, you know? So you're up all night. Sometimes you get up and sneak a snack because you're up, or you're watching the TV. So, I mean, again, all these little things plays a very important part. I find my patients grumpy when they come in because they didn't get a good sleep. And not to stray away, and I didn't want to push so much the prostate. One of the things that we do when we talk to patients about their prostate is that we ask them how many times a night they get up to urinate. And getting up 4 and 5 times a night is just not normal. Most people, it deprives you of sleep. Nah, you're becoming unhealthy. So, and I ask, most people must wonder, why you ask me that? It's normal to know. It's not normal. You should be getting up maybe once or twice a night, not 4 and 5 times. And when I check on that, if you're getting up 4 and 5 times, I now start to think your prostate is causing you a problem. Again, sleep, health issues, you know, they all related, yes. I mean, people should get the required amount of sleep. You should be well rested. Sleep, your body changes. It gets rest, the oxygen carrying capacity decreases a little bit. Your blood pressure, you relax, your musculature is not constricting around the blood vessels, so your blood pressure drops a little bit. Your heart rate comes right down, which is good. The muscles get a little bit of rest. And so, yes, it's very important. We need to look at all the global picture again. When looking at men's health, globally, we look from eyes to ears to nose to right down to the toes. Make sure you don't have crusty toes and thing, you know. Get one of the nurses to examine them, check them toes, make sure we ain't got nothing between the toes, right?
We can't forget, though, that as a urologist, obviously, you're going to look quite a bit at prostates or urological function. How do you define, or what would you define as good urological health and habits, as well as what constitutes a healthy prostate, to making sure that our prostate does not become, whether it be inflamed or all the conditions associated with it? What is it that you suggest that we as men do in order to?
That's a great question, and we've done a lot of research into how we can maintain a healthy prostate. And people will tell you about all these different medications and all the vitamins and ions and selenium and garlic and all this stuff to help you with your prostate. You know, there was always a concerning thing as to whether these things really work and make your prostate healthy. The American, which is like AUA, American Urological Association, that looked at selenium and they looked at garlic and they looked at a bunch of these things which people were saying really gives you a healthy prostate, which is what your question is about. And when they started the study and they started studying, and in about 5 to 6 years into the study, they had to stop it because they found that these things weren't working. People were still getting prostate cancer. And so healthy prostate, what really works, has always been a big question. What we do know, again, and I tend to look at more from the literature and say to you that tomatoes or lycopenes in your diet, which is tomatoes has lots of lycopenes, it works well for prostate and prostate cancer. So most people will tell you that it helps. Broccoli, red meat, they have been associated with increased prostate cancer risk. So cutting back on your red meat, fatty foods, they have been associated with these kind of things. So those are, dietary-wise, those are some of the things that you can do. Caffeine, frequency of urination is associated with that. Spicy foods, for some people, irritates the prostate, irritates the bladder, and causes these kind of a frequency. So from a dietary perspective, again, the same thing, exercises, oxygenation, getting exercise, getting good oxygen carrying capacity to the prostate, that helps. Does cigarette smoke help? Hell no. You need to. We've seen some association with preventative prostate help. There was a few studies out there which are stating that you can give stuff like finasteride or Proscar, which is a 5-DHT inhibitor, and it helps prevent you from getting prostate cancer. So some doctors love the fact and say, look, we can prevent prostate cancer by giving you these medications. It's good for prostate health. But one of the things that I think University of Miami had found out, that once you take these medications, what they found is, even though it looks like it prevents you from getting cancer, when you do get the cancer, it is a higher grade of cancer. So even though it does give you some help, at the end, it still affects you in some way. So those are a couple of things. Fluids, drink a lot of water is encouraged. I mean, it's always encouraged to do so. There were 1 or 2 studies which were shown that if you're using non-steroids on a daily basis, maybe an aspirin or a Motrin on a daily basis, it helped decrease the risk factor for prostate cancer. That was a study that came out of Japan, and they were using that as a preventative method. Again, we see some of these things. So again, healthy prostate goes back to the basic principles: diet, exercise, fluid intake, and again, all of these things can help. We were looking, I'll give you, everybody thinks that this is a joke, but it's really not a joke. There was a study out of Scandinavia, and I talk about this all the time, and they looked at 29,000 men. This is in Scandinavia. And what they were looking at is the amount of ejaculations per month and how does it affect prostate cancer, does it increase or decreases the risk. And what they found on an average, the men who had 21 and above intercourse during that month, the risk factor for prostate cancer decreased by about 3%, 3.2%. So it's a very funny study, but it's out there and it's documentation. Again, looking at prostate health and how you can protect yourself from some of the things that are out there. Importantly, the BPH, benign prostatic hypertrophy, frequency of urination. When you got to go, you got to go. Locally, most people think if you drink a little coconut water, it helps. We haven't had any documentation of it, but it's one of the things that the old people will tell you. We look at things like Stinneneckle, which they say help, and we've looked at a few studies. It's an average, and about 50% of the time it works and 50% of the time it doesn't. The pumpkin seed, right. Yeah, those things, sometimes it works, sometimes it doesn't. So I usually tell my patients, if it's natural, if it worked for you, go ahead. If it don't broke, no fix it. Yeah. You know what I mean? So those are some of the approaches I use when I deal with my patients about trying and preventing and to help them with their prostate health.
One of the things, and as a final question to you, that as men, a very keen interest is to ensure that we never become impotent. And what is it, as far as suggestions that you may put forth to the men here in Antigua and Barbuda to ensure that something like that never happens to them?
It's a good question. They're going to come run look for me now for advice. It's funny, and it's absolutely a great question, because again it goes back to what we initially started out with, and impotency. What causes impotency, and why do we get impotent as we get older? It affects. When we looked at the Massachusetts aging study coming out of this one came out of Boston, what they found was that a lot of men over the age of 40 do have some kind of impotency. Erectile dysfunction is the new term now. And 40% of men over the age of 40, some kind of erectile. But what we found was that these guys never wanted to discuss this issue with the doctors or with anybody, especially if your doctor's a woman. You don't want to go in there and tell you can't get no erection, It's a big problem. But the cause is exactly what you're trying to prevent, and the cause is exactly what you're doing. The basic problems for erectile dysfunction is your diabetes and your hypertension, the two major causes. So look, we're touching nerves here. So if you take care of yourself from early, if you come in and get evaluated, and if you come for your men's health day, you look at your cholesterol, you look at your diabetes and everything, that's basically you preventing yourself from getting erectile dysfunction. Why do these things cause erectile dysfunction? It's for the same thing that I spoke about earlier. Damage to blood vessels. Your erection depends upon blood flow. If you have good blood flow, you will have the strongest, hardest, firmest erection ever. That's why the young boys them have some really very stiff erection, because the blood flow is good. What damages the blood flow? Your high blood pressure, it damages the blood flow. Your diabetes, it damages the blood flow. So hence, erectile dysfunction. The other thing that damages blood flow is if you get trauma, pelvic injury. And what does that do? It damages the blood flow. So blood flow is very important for erectile function. And again, the basic things, the cholesterol will affect your blood flow, the diabetes will affect your blood flow, the high blood pressure will affect your blood flow, hence erectile dysfunction. So how do we prevent that? Go get your check. Go get your evaluation. Come check out AUA when they're doing their Men's Health Day, which is May 25th. It should be a good day where they do a good comprehensive evaluation of your body, and where we look at, we help prevent you from getting erectile dysfunction and from getting other stuff, because we are abreast and aware and on top of things. And these programs are very much needed to help most of the people in the community. Whoever can get over here and get evaluated can come over and get done. You get your blood pressure measured, you get your cholesterol tested, you get a bunch of some good stuff, which is helping you for the future, Again, for the men and MO Day, it helped prevent erectile dysfunction. All right?
Well, Dr. Thwaites, thank you for spending some time with us. Hopefully this will not be your last visit. We actually look forward to seeing and spending more time with you on the 25th of May. If you have any additional questions with regards to the topics that we have discussed here today, please feel free to email us at bewell@auamed.net. As we discussed in today's episode, guys, our health is a very important issue. It's understood that life sometimes causes us to put our health in second or even last place. However, part of living, part of providing for ourselves and for our families is taking good mental, physical, and emotional care of ourselves. Don't delay in seeking medical attention when necessary. When in doubt, guys, check it out. Take care of yourselves. We thank you for spending some time with us and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda. May your perspective always be a healthy one.
Healthy Perspectives, an AUA ABS initiative offering you a positive view on health.